Hi, good evening, and welcome to episode 4 of the Maternity and Midwifery Hour. And this one is supporting maternity staff through COVID-19, midwifery leadership and staffing initiatives. And as always, tonight's programme is being brought to you with the support of Matflix, which is where you need to go for your CPD and revalidation needs. There's video streaming from the maternity experts. Super online resources for these times especially. I'm really so delighted and thrilled that I'm being joined by two wonderful midwives and wonderful speakers. Firstly, Dr. Tracy Cooper, MBE, Associate Chief Nurse Midwifery at Warrington and Halton Teaching Hospitals, and Professor Trixie and McAree, Professor of Midwifery and Maternal Health at Birmingham City University. So welcome, Trixie and Tracy. And I was just going to start things off a little bit by asking each of you if you had a little moment of the week to start the evening off. And maybe we'll start with Tracy.
Okay, so my bright spot really of the week has been having reconnections with beautiful people that I've been privileged to meet throughout my career. So reconnecting by chance really through COVID. So because of the COVID situation, NHS England have released one of their midwives, Mel Hudson, who works in the north, and she's lead for continuity of care across the northeast and the northwest. So she's given 2 days of her time to come and work with me and my team, which is amazing. And also Debbie Gould, who does a lot of work with Aqua and NHS Improvement, and she's come to give some time as well as part of the COVID crisis, which is brilliant. So yeah, I'm really lucky.
It's wonderful. The midwifery world is so delicious because it's so small. We tend to know each other really well, but it's lovely when you see old friends as well as making new ones. Fabulous. Thank you.
Unexpected as well. So.
Yeah. How about Trixie?
Well, mine is more personal. So my son is a physiotherapist and he got COVID-19 through looking after people in his hospital. And he told me today he's going back to work again tomorrow. So that's very good news that he's going back, and just really pleased that he can keep working.
And he's fully recovered.
Yep, so he says. So that's encouraging.
Fantastic. That's wonderful. That's two lovely little bits of news. So thank you for that very much. Now I'm just going to start the session. Hopefully this will work nicely. And here we are. This is the Maternity and Midwifery Hour. And it's 29th of April 2020, just in case you didn't know. And this is supporting maternity staff through COVID-19, midwifery leadership and staffing initiatives. So this is brought to you by available on iTunes, Spotify, all podcast players, and it's supported by Matflix. If you haven't discovered it, this is a fantastic resource for lots of CPD, lots of fantastic speakers that you can catch up if you need your revalidation done, or if you're a student and you've got a project to do to complete. It's fantastic. The aim of this session really is to give you information to midwives, student midwives, aspiring midwives, student midwives, and anyone who's supporting women and babies and families at the moment, because we're very conscious that there's a real thirst for knowledge in bite-sized bits rather than huge long conferences. Having this sort of event where you can really listen to some experts and have some thought about what's happening. So if any tweeters amongst you, and I know in front of me, Trixie and Tracy are both tweeters, so I should think they're tweeting as well at the time too. The Twitter tag is hashtag Midwifery Hour, and the Twitter account is @Midwifery Forum. Just to highlight a bit of news apart from Boris Johnson's new little baby boy and Carrie's baby boy, which we congratulate them. This is a difficult time though, of course. But we just to say, Maternity and Midwifery Forum, and our last week's session was in the news as a sort of feature about home birth Last week's episode with Sarah and Abigail was a real inspiration for that. So if you're a Twitter person or you're into BuzzFeed, you'll find that information there. The other snippets of information are there are 2 new resources for the NHS workers. One, wellbeing support for NHS people, which is a telephone helpline for staff, which the information's here. It's 0300 131 7000, 7 till 11 p.m. daily, and you can also text Frontline. There's also something called NHS in Mind, which has been set up, the website of which is there, and this has got a number of different resources, so you can go into there and you can have a look at it, and you can do things to support yourself and really kind of uncharge, or when you're having difficulties. Very good resources. I haven't gone through all of them yet, but I think it's going to be something that's going to be very useful. And another issue for those creative people here is the Midwife Patchwork Project 2020, which is being led by Lindsay and by Jenny Hall, and the website is here for you to check out. You might be interested in sewing some little squares for a patchwork, which is then going to kind of celebrate this year, because it is the year of the nurse and the year of the midwife this year, just in case. I always put this slide up because I think while this crisis is underway, it's easy to forget that at the beginning of the year we were so excited and happy and thrilled about the year of the nurse and the midwife for this year from the WHO. And I think we need to start to kind of keep recapturing that. And also, actually, what I think over the last few months I'm feeling and finding is that we really are showing how valuable we are as practitioners, as nurses, as midwives. So it's a complete celebration. I'd as soon not had the virus to celebrate it, but it's happened. So next week is the International Day of the Midwife, May the 5th, which is the Tuesday, and there's lots of events locally and nationally and internationally. That includes a virtual 24-hour conference for those of you who've got the energy for dipping into something online for 24 hours, and there's lots of local events. Again, I've put some information on a little fact sheet with the resources for this, so you can check that out. I also want to just spend a moment or two thinking about the people in the health and social care services that we've lost. I think the number that is being kept is around about 148 at the moment. Those who've been lost within the maternity services, like midwife Lindsay Coventry and Linda Clark, and Joan Smickersfield and Elma Calvalida, I haven't pronounced that well, I'm sorry, at Northwick Park are some of our losses. But obviously there are so many people who've been affected by the virus, who know somebody who's been sick or who's died, or their family. And I think we need to think about those people and just maybe spend a bit of time, light a candle tonight, to just give some thought to those people. Really important. And not just the 148, but the over 20,000 people in the UK we've lost. And to sort of build up a little bit now, thank you to all the NHS and key workers and their families. I think one of the things, again, over the last few weeks is finding out how valued the NHS and our key workers and all the other people who look after us, even the lorry drivers, the supermarket workers, the mailmen, all the people that keep things going for us so we can be comfortable. Just the thing to remember, I know that a lot of services have had to be kind of slowed down or cancelled at the point of the virus emergency. But of course, in maternity, though we have additional stress and anxiety and sickness and staffing issues, maternity services can't be delayed or cancelled. cancelled. Antenatal and postnatal care is still required. Babies still continue to be born, and mums and families need the support. So that's why we're here, and that's what we need to remember, to look after our mothers and babies. I thought I've had some reflections of this last few weeks. The things about people are saying, when are we going to get back to normal? I'm not sure we're going to be in a normal the way it was. It's going to be a new normal. But there may be things that are very positive, like having a higher profile for the NHS. The public support and love for the NHS and the workers has been fantastic. Having more ICU beds and having so much better teamwork and understanding. And also new ways of working, like having Zoom meetings, Zoom conferences, meeting women online rather than having to bring them into clinics. And of course, there are different outcomes, but I think that Trixie and Tracy will probably talk a little bit more about that. So I think without any further ado, I'm going to move on to Tracy, because we're going to look at all the dramatic changes over the last few weeks. And I'm so pleased that Tracy's been able to join us. I know she's really busy, and she's someone who's got an MBE, and very deservedly so. That was in 2017. She is an associate chief nurse as a midwife. She's also held roles as head of midwifery, consultant midwife, and NICE committee member. She's a very busy person. But of course, like Trixie and Tracy, if you want something done, you ask a busy woman. The floor is yours, Tracy. Thank you very much.
Oh, thanks so much, Sue, for that introduction. That's lovely. I think one of the first things that I need to say is that when this first started, it's been 5 weeks now, and so much has changed, and we've done so much during that period that it's quite unbelievable, really, what you can achieve in such a short space of time. And I'm sure, as everybody knows, we're in a level 4 national incident situation, so it's very much led from government and brought down to us, so a command and control situation, really. So 5 weeks ago, we went into sort of critical incident mode within our services, and we had to move really quickly, stop all normal work and just focus on this situation that we were in. And it was about being really responsive as well, which we've enjoyed it, actually. We've enjoyed being really responsive, but it has been difficult at times. One of the first things that we decided to do is set up a central HQ within our women's and children's area, so that all the managers could come together, sit round the table, and we could sort things out very quickly, what needed to be done. So as you can see, this is based on our service and what we did. So I'm just using our service as an example. Just to give you an idea of the scale, 71 service change forms we completed and put in. So we've made 71 different changes to our services. The main source of guidance, as I'm sure you're aware, came from the Royal College of Obstetricians and Gynecologists, and from the RCM as well. We found that really useful, that they were updating their guidance. And currently we're on version 8 of the pregnancy guideline for COVID-19. And the guidance always comes out on a Friday afternoon or evening, which sends us into panic mode just before everybody's trying to finish, before they finish work on a Friday. So, but us, we've put managers on call over the weekend, and we've always had a senior presence around. We've had a senior manager on call 24 hours to help staff be enabled to deal with the issues that have come from this crisis, really. So as well as the pregnancy guideline from the RCOG and RCM, there's also been other guidelines that they've done: antenatal and postnatal guideline, antenatal screening guideline, the newborn screening guideline, 5-day blood spot guideline, guidance for midwifery-led settings and home. And I think there's another version 1.4 of that as well. Self-monitoring for blood pressure in pregnancy guideline. speciality guide for intrapartum care, version 1.9 we're on, and scanning in pregnancy. So there's been lots of different guidance that's come out that we've all had to adapt to and comply with. So obviously these are huge changes for staff to deal with. So we just made basic boxes within each area and made sure that we updated the guidance every time something new came up. We would get rid of the old guideline and put the new one in, and did a lot of it through social media on our Facebook work groups to make sure staff were informed and knew what was happening. I'll come on to the issue of PPE a bit later on, because that was a bit more complicated for us, but and I'm sure for everybody. But what was also interesting, and sometimes it was a relief in a way, was a lot of the programmes were paused. So NHSR, it was no longer necessary to report early notification cases to NHS resolution, and they're going to review that in September 2020. HSIB as well reduced the cases that needed to be reported. They're going to triage the cases and do them by priority, which makes it a bit easier. Embrace guidance as well. We still need to complete that, but they've done a 3-list criteria, which has been really helpful. The organisations came up with things really quickly, which I thought was very helpful. So it helped us put a lot of things on the back burner to enable us to focus on other things. So Each Baby Counts as well was paused for 3 months. And HSI and the Maternity Transformation Programme paused. So, for example, all the continuity of care targets are put on hold. Submission for the neonatal critical care review, those implementations were put on pause as well. NHS Digital said that we didn't have to comply with the things that they needed doing. So that was a relief as well in a way. And the digital maternity record standard compliance as well was paused. So those things helped us. And one of the biggest things was the CNST safety actions, because as you know, it's becoming harder and harder every year at the moment to comply with all the safety actions. So to pause those has really helped us. I've just put the examples there. I won't go through them all in detail, but just to say that all the safety actions mainly have been paused, except for things like Saving Babies' Lives Care Bundle. We're still continuing with that, but modified the scanning part of it, and also the CO monitoring of pregnant women is paused because of the respiratory issues associated with that, obviously with COVID. So those things have really helped. I would say our key service changes, I could go on about all of this all night really, but I'm conscious I've only got 15 minutes. So I'm just going to go through our main key service changes. So one thing for us, which we weren't expecting, we love providing a home birth service, but we quickly found that we had issues with staffing due to either people having symptoms of COVID or shielding or self-isolating, and our midwifery staffing went down by 25%, and 40% of our community staff were affected by that as well. So we really had to look at our home birth service, and unfortunately we had to suspend it at that point to enable us to cope with all of the work that was needed to be done within community as well. We quickly adapted all of our community services, swiftly changing a lot of things to virtual things that we could do. Luckily for us, we have Jude Jones, who works with us, who did the Face Mums project. So Jude is shielding, so she stayed at home, but she sorted all of our social media stuff out. She's been brilliant, and she set up little private Facebook groups for women to join and provide support through those groups. So she moderates those groups as well. So any questions about COVID or anything, they can join those groups, but they'll also get antenatal information, our hospital tours, our parent education programs, all things like that they can access, which has been really useful. We've tried to push everything, all of our messages through social media, so women are really well informed. And because the changes have happened quickly, sometimes it gets a bit confusing of what those messages are. So we've had to try and make sure that they're very clear and concise about what we put out. So I think that's worked really well for us, especially having somebody leading that and in charge of it, so to speak. So she just picked it up and run with it, which has been brilliant. We've also put things like we provide hypnobirthing classes to every woman if they want it, and we've put all that online. So one of our midwives, our community midwives that is shielding at home, she really loves hypnobirthing, and she's done a programme that women can access virtually. So she does that on a regular session on a weekly basis, which is brilliant. We also had to look at reducing elective section lists and things like that, because our anaesthetic team were being pulled into the issues with ITU and having to support more patients there. So that was starting to affect what they could provide for us. So we had to spread our section list out over 5 days instead of just doing it across 2 days. So that was something that we had to react to as well. One of the other things that happened was that at 4:30 one day we got a call from the children's centre leads to say that they were closing all the children's centres that evening for probably 12 weeks and wouldn't reopen them. And all of our women were booked in there for their antenatal care with the midwives, because all of our clinics are in the children's centres. So we had to quickly try and rush around to try and find somewhere else. The LMS were really helpful with trying to find different places for us, like village halls and things like that, for us to enable to get women there for the next day, that first day that it had closed. So our community midwives were phoning around women late at night to try and enable that to happen. But then we talked to the children's centres, and they did enable opening 3 back up for us, which has been really helpful. So it was just things kept happening so quickly last minute that we had to be really reactive with. We've suspended our acupuncture service. We provide a really good acupuncture service, but that's suspended at the moment. But that's probably the only thing that we've had to suspend, apart from the home birth service as well. We also, at that point as well, had 50% sickness with our, well, not sickness, but due to COVID-related issues, had 50% of our obstetric consultants that were off as well. But now we're in a different situation. Our staff have started to come back, so that's increasing, and we're not having as many staff go off, which is great. So the balance is starting to tip back again now, which is great. So we've got 100% of our consultant obstetricians back in work, which is brilliant. And instead of 25% of staff off, we've got about 15. So it is improving slowly. So hopefully we're intending to relaunch our home birth service within the next couple of weeks, hopefully. Okay, thank you. So one of the other things was visiting and women being really disappointed about their partners coming, especially like through induction and coming to the wards. So that's been really difficult for the midwives and for us, and also wearing PPE and masks and things like that. I'm just going to flick through the stuff that we've done, but we've done so much work on PPE, you wouldn't imagine, honestly. It seemed like it was changing every 5 minutes, what we needed to wear, what we didn't need to wear, and what we had to wear for this and what we had to wear for that. And the RCOG and RCM guidance has been invaluable with that, because the whole hospital all works together on one general perspective of PPE, but we're very different, aren't we, with labour and birth? So that's been something that we've had to harness. So our consultant midwife and practice development midwife just picked that up and ran with it, and they did grab bags for the midwives to take into the rooms that we identified for women that were suspected or confirmed cases, so you didn't have to keep coming in and out and things like that. So it was just looking at everything, and the consultant midwife and practice development midwife have done loads of videos as well. This is how you don, this is how you doff, this is what you need to wear for second and third stage of labour. This is what you need to wear for the first stage of labour. And this is what you need for theatre, all of those sort of things, and worked with the medical staff as well. And we worked together really well as a multidisciplinary team. But it's been challenging at times, but in a way we've really enjoyed it, and a lot of the things that we've changed we're going to keep moving forward as well, especially a lot of the virtual stuff and things like that we've done. So yeah, there's been a benefit to it. Things that we've wanted to change for a long time we've just been able to do because of COVID, really, and that's really helped us to make change a lot quicker than what we would have done without it.
Fabulous. Fabulous, Tracy. Thank you very much. I especially like the slide with mask etiquette.
Yes.
And I think what your talk really illustrates is the nimbleness of having all that information and having to work so quickly.
Yeah.
Right, for your team. I think that was really very, very helpful in sort of understanding how you have to be as a leader and a manager of a service, making sure the staff can get on with their job because they know what they're meant to be doing.
Yeah, well, hopefully, yeah.
I'm sure if anyone's listening and they have a question, they're going to have to think about it and send it out on Twitter to come in to me. That's why I have my little phone here by the side of me. So thank you very much, Tracy.
Okay, no
we'll move on to our second speaker, who is Professor Trixie McAree. I hope I pronounced that correctly. I always call Trixie, so I'm not using her second name very often. And I'm delighted that Trixie can be with us. She's a professor at Birmingham City University and very much a clinical academic, I think is how she'd describe herself, if I'm correct. And she's also held roles as head of midwifery, consultant midwife and safeguarding midwife fairly recently. So she's very clued up on all of this stuff. So Trixie, the floor is yours. Thank you very much.
Thank you very much. Just get my slideshow up and running. So following on from Tracy's presentation, what I want to talk to you today about, hang on a minute, my slides have gone slightly awry. There we go. I want to talk to you about inspiring midwifery practice and celebrating good practice in a time of crisis. And following on from what Tracy Cooper has just been telling us, we are inspired by you, Tracy, and looking at all the good practice that's gone on across the country, we should indeed be celebrating. So my name is Trixie McAree, as Sue has said, and if you'd have told me in February that that we would be in lockdown now, I would have thought that was strange. So my job had been at that time going around the country supporting people and helping maternity services set up their continuity of carer teams. And now obviously I haven't been able to do that. So I've had the opportunity to work clinically with people. And what I want to think about today is operating and inspiring each other as midwives and celebrating together for what all of us are able to achieve. So this session is really all about midwives, and what I want us to think about is how we can inspire each other, how we lead each other, support each other, commit to each other, and celebrate everything that we're doing. So let's think about inspiration. What I think we want to do through this crisis is think about what innovation has taken place and celebrate it. So Tracy's given us a whole list of the 71 change management things she had to do up north there. In Birmingham Women's, we had to we set up a telephone triage, for example, in a very new way of working. We moved services around. We managed to keep our home birth team. We've managed to keep 2 continuity of carer teams running despite all this. So what we want to look at is what is good that we could keep hold of, and how do we keep hold of it, and what have we changed, and actually what have we changed for the better. And think about that. We all want to be inspired. Whenever you read any kind of leadership stuff, they always say, yeah, you need to inspire people. But actually, all of us as midwives are the inspiration. And inspiration is when we get enthusiastic about what we do. So, for example, today I was working on our birth centre, and I worked with a student, and we had the most lovely birth, we thought, and the woman thought, which was very woman-led, and the woman stood up and she was mobile and she was able to eat and drink in labour, and it was just a really positive, enthusiastic experience. And we were able to sit down and talk to each other and inspire each other about remembering what good midwifery looks like. And that is something we can do despite sitting in a crisis. And that's what I want us to remember. In 2018, the RCM published the Whelm study that some of you may have seen, and it's kind of highlighted how stressed and pressured midwives were. Well, actually, we can use this crisis to move forward out of where we are and think about where we would like to be, and see the strength that we have in managing this crisis, in moving services around, in coping with different things, in accepting that 1 minute there's one guideline and the next minute there's a new guideline. 1 minute we're putting on masks, the next minute we're putting on 3 gloves, and all the different things. And that shows how strong and how versatile and how able we are. And that's what we want to celebrate. And then we want to use that strength, recognize that strength, and move forward and inspire ourselves to think, well, how do we want maternity transformation to look once this crisis is over and we can go back to something that looks vaguely more normal? But we want to think about, what should normal midwifery look like? What is the midwifery of our future? We want to think about how we now embrace maternity transformation, continuity of carer in particular, and how we can do that based on the lessons we've learned through this crisis. We want to share all the innovations. I'm sure maternity units across the country have done many amazing things. We want to gather those things together so that we can learn from each other and share all the best practice out. So I'm happy to accept any emails telling me about what people have been up to, just that we can collate it somewhere if that's what some people want to do. But it's really about getting inspired and thinking about what should recovery look like. So that's the inspirational element. But in order to be inspired, we need to start off with our values, because our values are the things that drive us. So our value is what makes me get up and do something in the morning. So I have a personal value that I've held for a very long time. And that is that I very strongly believe that what I want to do as a midwifery leader is empower midwives to empower women. We want people to take responsibility for their own health. We want them to do things like stop smoking. We want them to make healthy choices. But we can only do that when we feel empowered ourselves to be able to do it. So that's one of my values. The other value is in recognizing that midwifery is not just the safe delivery of a baby. It is actually a huge public health issue where, as we do midwifery well, we ensure that there are good long-term health outcomes. For example, people less likely to get cardiac disease because the mother and baby dyad were healthy at the beginning and throughout the pregnancy, but also influencing things like maternal mental health and mental well-being. So, because we know that when women are well, they are more able to talk to their children and bond with their babies, and those children then go on and do much better at school, which then changes long-term outcomes. For example, it enables those people to grow up and do well at school and get a job, and so we're actually tackling health inequalities as well. So getting your own set of values and working out why you're a midwife and why you want to do that is really important, and that then influences our attitudes, that changes our behaviours. So we all lead. And that means what we say and what we do makes a difference. So when we've got our colleagues coming, for example, with an innovation, how do we respond to that? Because our responses make a difference to whether things are accepted and whether things fly or not. But in order to influence and lead, we need to have a vision, purpose, we need a plan, we need to play to our strengths. That means we need to know what our future should look like together. We need to know why we're doing it, which is where the values comes in. And then we need to work to a plan together. And then also understand who we are. So if I was a right-handed tennis player, for example, there's no point in me practicing to try and play tennis with my left hand, because that would never do. We need to understand who we are and the part we play in all of this. And between us, we should be encouraging each other and looking for ways of building each other up, so we do start to play to our strengths, to lead with our values. And then we lead by example. So we get up and we do what we say we were going to do, and we shouldn't be saying they should be doing, but we should be doing what we think we should be doing. So then it comes to thinking about, well, if we're going to do this, we need to be able to support each other. Now, the obvious place of support, as we know, is the professional midwifery advocacy process. And in case anybody's forgotten, in the A-Equip document, it tells us the PMA is the new fundamental leadership and advocacy role designed to deploy the A-Equip model. The role supports staff through a continuous improvement process that aims to build personal and professional resilience. So PMAs are there to support us. They can do things through restorative clinical supervision, and they can also help us think about new innovations to make our services better. When I was doing the national review, one of the midwives said, PMAs are pivotal to our roles as midwives, and they assist us with both practical and emotional support. And so that's actually what they're there for. And we can use our PMAs, particularly in this time of crisis, if we're feeling stressed or stretched or in an experience that is unfamiliar to us. So we have somewhere to go and talk. Now, the national team did think about setting up a national solution, a helpline, like a PMA helpline, because the line of thought was midwives are too busy to be able to provide that within in-house services. But then looking at best evidence, it seems that is not the best way of going. And what we've learned by looking at the best way of supporting each other is that care needs to be, in the first place, proximal, which means that care needs to happen within teams. Teams look after each other. We have a sense of connectedness and a sense of belonging, and that enables us to look after each other far better. Second thing is that care needs to occur immediately. So if someone is feeling stressed because of a clinical situation or something that's happening at home, it needs to be dealt with quickly, and that issues need to be dealt with as they occur. We need to look at our situations, understanding that an end is going to happen, and any solutions that we put in place need to be kept simple, because what we want to be doing is maintaining normality as far as possible. So when you think about how we support each other, you can see there you've got the acronym PIES. Should help us to think about this and to help us remember that support happens within the context of the team. That means that all of us, it doesn't matter if you're the most junior midwife in the building or the most senior, we can walk around, we can talk to each other, we can check in with each other, and we can make sure that we're all doing okay, and see that, you know, if someone's looking a bit frazzled or stressed, we can always just say, how can I help? And that gives a space for someone to accept your help or not, as the case may be. Now, there's a lovely example of good practice in Tame and Glossop, where a lovely midwife called Nicolette Peel is shielding because she can't come to work. And what she's done is she set up 2 PMA Zoom restorative supervision sessions. So on the one hand, she's doing a restorative supervision for the midwives that are working clinically, and running that as one restorative supervision session, and then she's doing another one for midwives who are feeling at home, who are maybe feeling a bit I wouldn't like to use the word left out, but I think it's very difficult when you're not busy doing. Sometimes that feels difficult as well. So she's running a session for them. So that's a good lesson for all of us. And she's doing it by Zoom, which is making it much easier for people to access that service. Teams are just desperately important. We can't underline that sufficiently as we try and inspire each other, as we try and support each other, as we celebrate what we're doing. The best way this comes out is within the context of teams. Now, most of us are familiar with Michael West's work. He's been looking at teams within the NHS for many, many years. I don't know how many. And his conclusions tell us that when we work well in teams, we come to work because we're really happy about coming to work. We enjoy our work far more. We make a lot less mistakes at work because we feel confident to ask each other when we get stuck with something. And therefore, patient outcomes or women's outcomes, in our case, are far, far more successful when teams function well. And this is very, very important, obviously, within the context of being in the middle of this COVID crisis. So I wanted to just do us a little slide on committing to teams and thinking about being committed to each other and how that works within the context of teams. Now, there are many different books about how you need to run your teams and the best way of doing it. But I rather like Patrick Lencioni's explanation. So he says there's 5 ways that teams either work well or don't work well, depending on the circumstances. And he's done it a bit like Maslow's hierarchy in a triangle. So the first thing we have to do when we work in a team is that we have to trust each other. If I don't trust you, I'm not going to come out of my room and ask you about that fetal heart, or I'm not going to come out and ask you about my trace, or I'm not going to ask you about feeding the woman, or whatever it is that's concerning me, if I don't trust my colleagues. So the most important thing is we need to learn and decide to trust each other. The second thing is, in a team, it's okay to have conflict. We are afraid, I think, as English people in particular, of disagreeing with each other because we might offend somebody. But actually, there's nothing better than a good disagreement, because in discussing things, you say one thing, I say something else, it doesn't mean that we don't like each other. It just means that we're thrashing out, looking for the truth, working out what the best answer is going to be. And what we have to do is say, well, we're going to allow conflict and encourage conflict within the context of our teams, as long as it's boundary conflict. And that means that we then, just because I don't get my way or you don't get your way, it means that we don't work together or we don't like each other anymore, because it's not a competition, but actually we want to work. We want to come to the best solution, and that means sometimes being free to have the conflict, but at the end of the day, agreeing to disagree where appropriate. We need to be committed to each other, accountable to each other, and then focus on what's most important, and that's giving the best possible care to women. So that brings me to my final slide, which is we need to celebrate who we are and what we can do. Every day might not be a good day, but there is something good in every day. We need to keep smiling at each other, because that makes a massive difference. So I don't know if you can see this, but as I just said that, I can see Tracy and she smiled at me. And that's just the most encouraging thing ever when we work, because we need to keep affirming each other. Look for ways of paying it forward and serving each other. I cannot underline the importance of servant leadership, actively listening to each other, asking each other what we think about, thinking about how we respect each other, trusting each other, being vulnerable to each other, admitting that we don't know everything. That's a really scary thing. And out of all that, we celebrate who we are together as midwives, and together we will then find a new normal going forward, and we will survive this crisis. Thank you very much for listening to my presentation, Sue.
Fabulous, Trixie. Fabulous. I think that was really excellent. I like the that Maslow type pinnacle, because that really pulled it together really well. That's fantastic. Thank you so much to both Trixie and Tracy. We do have questions now, and my little phone has been bleeping away as I've been going, so I'm going to okay, I've got just a comment really from Jackie Gerard. Just want to congratulate Tracy and her team in doing what sounds like a really successful and huge change for local women. Wondering if you've brought in any of the retired midwives from the COVID register, and if so, how did they cope?
We only had one person actually from the retired group. Well, she actually wasn't retired. She's a health visitor, but she hasn't been in midwifery practice for 20 years. But she wanted to help support, so we put her in touch with the hub that's dealing with that within our trust, and she's been able to do some work with the community midwives in community, you know, for the day 5 visit to help get that transition from midwife to health visitor and make that a bit easier in the COVID crisis, because there's lots of health visitors as well that are often have been affected. So it's making sure that the midwife can get in touch with the right health visitor. So sometimes it's just assisting with communication and things like that that people can help with. So that's been really useful.
Yeah. Making sure you're using everyone, as even in a little way or a big way.
Yeah.
I've got a query here from Joe Ratchford saying, how are you utilising your shielding midwives? And I think you mentioned Nicoletta, didn't you? Or was that Trixie?
Nicolette, yeah, I mentioned. So I talked about Nicolette Peel, who's at Glossop and Tame, and she's running, amongst other things, she's running the 2 PMA groups where she's running restorative clinical supervision for both the clinical staff and the ones that are shielding at home. So that's one way. I'm also aware that some of the girls at home in Birmingham are supporting the clinical governance team with various bits of audit and writing and complaints and things that you can do from home. So they're doing that sort of thing as well.
That's fab, because I think in weeks gone by, some people have talked about some folk who are shielding or can't work for some reason have felt guilty. So being able to use people in these ways is really very positive, especially in terms of the bigger team. That's great. Thank you very much. I've got a question from Sarah Ezegbuna. How about women without access to social media, hard to reach women who might have language barriers? I think that might be one. Well, that could be Tracy, do you think?
Yeah, so we also had a helpline, a telephone helpline, as well as social media, and also trying to ensure our midwives got in touch with those women that are hard to reach, vulnerable groups, and women that don't speak English. Within our region, within our area, we don't have many women that can't speak English actually. So it's not a real issue for us, but there have been a few. And also what's really important is to make sure that you're outreaching to women within lockdown that maybe have had issues with domestic abuse and things like that. And that's one issue that has raised its head quite heavily within our area, is that we have found more women that have been in receipt of domestic abuse, so we've had to support them. So it's making sure that the midwives keep in touch with the women to ensure that they're okay, even if it's just a call. And that's what they've been doing more of, really, is telephone calls and texting, you know, virtual kind of stuff as well. So I think that's been helpful.
Yeah, sounds fab. Trixie, did you want to add anything to that one?
It's just about screening and risk assessment. The most important thing in midwifery, I think, is the risk assessment of the woman. And when you do that, that gives you the opportunity to work out how you're going to maintain contact once booking has occurred, really. And so that's what our midwives have been doing.
Fantastic. Okay, I've got a question from Nepal now.
Wow.
From Prasanna Buddha Lama. And she says, what is the full form of PMA? I think that was one for Trixie.
Yeah.
Which I think you had on the slide, didn't you?
Yeah. Professional midwifery advocate. It's a midwife that supports normal midwives to be the best possible midwife they can be by looking at quality improvement and by giving them support through restorative clinical supervision. Is probably the easiest way of describing it.
I think because people in other countries may or may not know that every midwife will have a designated PMA to support them. And that person may not be a senior person, but they're usually very experienced.
Yes.
Because Tracy Jane Hogarth has said, it's more of a statement, the PMA is pivotal to midwives and teams, needs to be accessible and visible, working with staff to meet individual needs. Anxiety is high and this needs to be acknowledged. Staff need an opportunity to talk and we need to listen and support and keep positive. Yes.
Can I just pop in here and say, I have been, I don't know, impressed perhaps is the right word, about how positive the midwives have been. So I'm working clinically at Birmingham Women's, but I've spoken to others as well. And I don't know, Tracy, if this is your experience, but actually the midwives have been really, really positive during this period. And actually some trusts are reporting that sickness has gone down, not COVID sickness, but other generalised sickness has gone down and people are coming to work. And there's been such a lovely camaraderie that people are supporting each other, even outside of the PMA thing, within the context of their teams, which is really encouraging and something to celebrate.
Absolutely.
Yeah,
I think that for you.
Yeah, I agree, and I think a lot of support from the public as well has really helped. Sort of cheering people on who are working in the NHS and also carers as well. Yeah, it's been lovely, and like even food and things like that, and it's a difficult shift and you haven't eaten because it's busy, things like that. It's lovely to receive gifts that just help you get through that day, which is brilliant.
Even little things. I mean, I noticed my local unit, they're serving free food and organising a little supermarket for the workers and little gifts. And they don't have to be big gifts. People, I think, are very touched by the fact somebody cares about them. It's really lovely. Fantastic. And I've just got one more question, I think. From Jackie Gerard. Trixie, I'm wondering how the final year midwifery students have coped, as they will have been thrown in the deep end. Or not, I don't know.
Well, yes, I think nationally there's different things going on in different places. So the student I mentioned today, who I work with, who had 3 more deliveries to do until she was qualified, and so she managed to get all 3 today, although I was only with her for 1. They have done very, very well. We've put lots of things in place. For example, Zoom, instead of doing preceptorship meetings, they've done lots of things via Zoom, which seems to be working quite well, and just looking at various different additional support mechanisms. But not all trusts are taking on the 3rd year midwives. I think it's very variable across the country, so I wouldn't like to say in a general way exactly what they're doing. I just know what we've done, which seems to be working.
I guess it's a good time for those students to really see the strength and support of midwives themselves, I guess.
Yes.
What I've been struck with all of these discussions we've been having, though it's such a difficult time for a lot of people, there's a lot of positive things and positive feelings, which is very strengthening. And I'm using Trixie's word here because you're using strength a lot. And I think that is important, because I know there's research that says if you're in a team, even if you're stressed and having to work really, really, really hard, if you feel looked after by your team and happy with your team, you can cope with amazing amounts of stress. That probably comes from Michael West, if the truth be known.
Yes.
Yeah.
I think
I'm sure it will do.
Yeah.
I think hang on. Now I've got one more question. Last question. Sarah Abigail. Sadly, we've had our PMA time taken away. It's deemed non-essential. I'd argue that service is needed more than ever. Such a shame. I don't know where Sarah works, but I think that's a comment more than a question. And I think we've actually reiterated how important having a good PMA is, or having some sort of in a different country maybe, clinical supervision.
And I think, though, it's about focusing on your team, and building that relationship within your team is desperately important, because not everywhere can have a PMA, but we can all do the functions of PMAs, whether we're qualified PMAs or not. And we can all look after each other, doing the sorts of things that I talked about in my slide set. And by doing those things, we will encourage each other, and we'll support each other, and we'll get through it, even if the PMA can't be released in the traditional way.
Okay, and that's a wonderful finishing point for us for this evening, because I'd like to carry on talking to Tracy and Trixie forever, because they're so inspiring and they're such founts of knowledge, but we have to let them go. And I'd like to thank both Trixie and Tracy very sincerely for their input today. I know there's going to be some questions afterwards, and we'll have a look at that a bit later. Some of us will be on the social media to answer some of the questions. There's also resources available on the website. I have to do a little shout out for Matflix again. Take a look at the video content, a very good place. If you're looking at revalidation or you've got your project to do, we also do have very good partners, the Practicing Midwife Journal and the All for Maternity, with their online resources. And they've done some beautiful new resources, really visual, fantastic. I haven't dug through all of them, but they're looking really good and really useful for practice. And I need to say that next week in the Maternity and Midwifery Hour, we're going to be looking at regulation and the changes that needed to be made to support staff coming in and to support students. And so look out for that. We're going to be looking in the following weeks at preeclampsia, compassion, infant feeding and breastfeeding in lockdown and with COVID-19 in mind. So keep an eye on the topics coming through, and I hope to see you there. In the meantime, please stay safe and well, and look after yourselves and your loved ones, and we'll see you next week. And thank you again to Trixie and Tracy, our wonderful speakers. Thank you very much.
Pleasure.
The Maternity and Midwifery Forum brings you Matflix, video streaming from maternity experts. All your CPD and revalidation needs met in one place. Our expertly curated box sets are the perfect way to engage with the latest thinking, issue by issue. They make revalidation easy and are the perfect accompaniment to any project or university coursework. In addition to video from expert speakers across maternity and midwifery, there is easily accessible research and links to the latest government policy documents. Our reflective questions at the end are the perfect primer for your revalidation. In the same way the Maternity and Midwifery Forum provides certificates to show that you have attended these festivals, we can provide certificates for those who have consumed the content of a box set and submitted their written answers to the reflective questions provided by our curator, Dr. Jenny Hall. Midwives, maternity professionals and students, do not miss out. Subscribe to Matflix today. Box sets are £17.50 each, or access to them all starts at £6.99 per month. Students pay just £2.99 a month. Check out the box sets and subscribe today at www.matflix.co.uk.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.